What's up everyone, my name is Yam and this is the first episode of Breaking Down Bacteria in which we will talk about the different medically important bacteria. For today's episode, we will discuss about Staphylococcus aureus. For today's video, we will discuss about the general characteristics and epidemiology of Staphylococcus aureus. We will also talk about its virulence factors as well as the infections it can cause. And lastly, we will also talk about the treatment and prevention. The Staphylococcus aureus are a unique kind of bacteria. These bacteria are commonly found in our body, primarily in our anterior nares. S. aureus can also be located in the vagina, pharynx, axillae, and other skin surfaces. Additionally, these bacteria are frequent pathogen in nosocomial infection, which means that it is commonly acquired in hospital settings. In terms of characteristics, it is a gram-positive cocci, which means that when it is stained, it would show a purple, spherical shape under a microscope measuring about 0.5 to 1.5 microns. These bacteria also appear in clusters, hence the name bunches of grapes. They are non-motile, which means they do not have any means to move. They are also non-spore forming, which means that its virulence is not dependent on producing spores. Later, we will also discuss what makes S. aureus pathogenic. These bacteria are catalase positive, which means that it has the enzyme catalase, which enables it to produce water and oxygen in the presence of hydrogen peroxide. It is also the only medically important staphylococcus that is coagulase positive. The pathogenicity associated with Staphylococcus aureus are enterotoxins, toxic shock syndrome toxin 1, exfoliative toxin, cytolytic toxins, protein A, and different enzymes such as your protease, coagulase, hyaluronidase, and lipase. Enterotoxin is associated with staphylococcal food poisoning since this toxin is heat stable, which means reheating food does not prevent the infection. Other toxins produced by Staphylococcus aureus along with toxic shock syndrome toxin 1 become super antigens and have the ability to interact with many T cells, and it activates an aggressive, overreactive immune response which causes the toxic shock syndrome. Exfoliative toxin is also known as epidermolytic toxin, which causes the epidermal layer of the skin to slough off. This is known to cause the staphylococcal scalded skin syndrome, sometimes referred to as the Ritter's disease. This toxin has also been implicated in bullous impetigo. Cytolytic toxins are toxins produced by Staphylococcus aureus that affect the red blood cells and leukocytes. For the enzymes, the protease, lipase, and hyaluronidase are capable of destroying tissues, and it may facilitate the spread of infection to the adjoining tissues. The protein A is a component of the cell of the S. aureus. It has the ability to bind to the immunoglobulin G or your IgG, which blocks or inactivates phagocytosis and negate the protective effects of your IgG. Staphylococcus aureus can cause skin and wound infections. This includes folliculitis, which is an inflammation of the follicles or oil glands, furuncles or your boils, which is an extension of the folliculitis but with large raised superficial abscesses, and it also can cause bullous impetigo, which are larger pustules surrounded by a small zone of erythema. These infections only occur when a person has a previous skin injuries such as cuts, burns, and surgical incisions. Scalded skin syndrome is also caused by Staphylococcus aureus. This is a bullous exfoliative dermatitis that occurs primarily in newborn and previously healthy children. The severity of the disease ranges from localized skin lesions like a few blisters to a more extensive condition that can affect 90% of the body, which is known as your Ritter's disease. Toxic shock syndrome is a rare but potentially fatal multisystem disease characterized by a sudden onset of fever, chills, vomiting, diarrhea, muscle aches, and rashes, which can quickly progress to hypotension and shock caused by the overreaction of the immune system. This disease is menstruating associated, which means it occurs to women who does not have good hygiene practices when it comes to changing tampons. Staphylococcus aureus also causes food poisoning and gastrointestinal disturbance. This occurs only when the person accidentally ingests contaminated food, caused by improper handling or storage by a food handler. Symptoms will appear rapidly and resolve within 24 to 48 hours. For the treatment of Staphylococcus aureus, it is treated with penicillin. However, resistance to penicillin have been developed through time because of improper intake of antibiotics. Now we use penicillinase-resistant penicillin like your oxacillin, flucloxacillin with aminoglycoside. Other antibiotics can also be used like your methicillin, nafcillin, and dicloxacillin. The best way to prevent staphylococcal infection is through hand washing. Always remember to wash your hands with soap and water and rub it for at least 20 seconds, or you can just sing happy birthday twice. Also make sure to keep your cuts and scrapes clean and covered with bandages until they are healed. Thank you so much for watching. Don't forget to like and subscribe for more videos like this, and I'll see you on the next video.